All right. Are you a caregiver in the private setting or in the professional setting or in the home care setting? All right. If that is you, I need you to stop and listen to this. This is some mistakes that we make all the time. All right. So let's get started. Hi everyone, it's your favorite nurse Peju. How is everyone doing today? I am excited to be here. And today we're going to be talking about some of the biggest mistakes as caregivers that we make in the home setting. Alright, so let's get it. And if you're liking what you're saying, please make sure you share, subscribe, and comment so that way we can continue to grow and make more impact. That way someone that really needs this information can get it. But more importantly, let's go ahead and get started. And remember, on this channel, our focus is to bring professional care with some personal touch and make it practical daily so we can all be successful. So today we're going to be talking about the biggest mistakes as caregivers that we make in the home setting. So let's get started. Now, when I say caregiver, that could be a mother, a child caring for their parent, or a mother caring for their child that has some level of illness. Or if you're just responsible for the people that are around you, or if you're a caregiver in the professional setting and you're caring for other people. So you are the one that I'm talking to. Are you the mother? Are you the child? Are you whoever you are? You're the one that I need to talk to today. Yes, that's you, because I know you're not doing what you're supposed to do. All right, so I know you're taking care of your patients or your clients or your family members with a whole lot of love. So today I am going to be taking care of you with some love and help you prevent some mistakes. Number one thing, let's stop normalizing stress. Stress is part of life, but it's not normal to stay in a constant state of stress. So it's also not normal to stay in a constant state of burnout. Staying in the constant state of stress is as bad as being burnout. So that's long-term stress. So long-term stress automatically means burnout. And when you're burnout, things are not going to fall in place. You're not going to be where you're supposed to, and it's going to be hard for you to recover. So if there's like an infection, let's say the infection is supposed to last for 3 days. If you're constantly burned out, probability is going to last longer than the 3 days. Or if it's 7 days, it's going to be longer. So those are some of the impacts of the long-term process of being burned out. We cannot afford to stay burnt out and say it's okay and it's normal. No, it is not normal. So let's stop making it normal. All right, so that's one. Number two is skipping our rest days. What are those? In days that we need to recover, get proper sleep, get proper workout, get proper breathing, get proper yoga, get proper Pilates, whatever floats your boat, whatever makes you happy. If it's going out to dance, if it's going out to hang out with friends, what is it you're doing to recover from caring for somebody else? Because when you care for others, which is a necessity, it's also demanding. It's a very demanding job because most of the caregivers still have another job. So they go to work, and then they come back home and they're still working. So it's like they're working back to back. So what are you doing to recover? Then the next thing is not checking your own blood pressure constantly. I know whoever you're caring for, you're very diligent. You even have a log on making sure that blood pressure is checked properly. My next question is, when are you checking yours? How are you checking yours? Are you also checking yours as you're checking theirs? So please make sure that you are also taking that time to take your own blood pressure. Last but not the least is eating anytime and anyhow. So you do not have to be diabetic to have your blood sugar all over the place. You need to have a steady and a planned out routine on what you're eating and how you eat. In the long run, it's never a good thing to just have your blood sugar spiking all over, which is why you also want to make sure that you're eating properly nutritious meal. That being said, so I know as a caregiver, I'm just as responsible sometimes when I tell you all these things, because it's so easy to get caught up in caring for somebody else and neglecting to care for ourselves. So that is one of the things I want to make sure that we're focusing on, because we want to hurry up and wait. We want to hurry up and get to this appointment. We want to hurry up and get them ready for this. We want to hurry up and get them up to track. So those things are understandable and those things are expected, but in the long run, there is some price to pay. So at this moment, all I'm saying is let's make sure that we address these 4 things and make sure that we are doing what we're supposed to do. So again, stress is not normal. Burnout is not normal. We need to make sure we recover. We do not want to skip our rest days. And we also want to make sure that we're eating properly so that our blood sugar is not all over the place. And last but not the least, we also want to make sure that we are checking our blood pressure regularly. I know you're checking for those people that you're caring for and your loved ones. I just want to make sure that you are also caring for yourself and making sure that you check your blood pressure regularly. All right, everyone, it's been real. If you like what you're seeing, please make sure to share, subscribe, and like. Until next time, stay healthy, stay vibrant, and stay smiling. It's your favorite nurse, Nurse Peju.